Welcome back. This set of exercises today is to work on a progression of what we worked on previously, those functional movements, getting into a little bit more of single leg loading, single arm loading, and just progressing some of that core stability. So this is appropriate for anywhere from 9 to 12 weeks postpartum. Again, listen to your body. If things from the previous week still feel challenging, don't involve yourself in the progression. Maybe give it a try at a decreased rep and set situation. A lot of times when we're developing single leg and single arm loading, it brings in a balance component that might be significantly challenging for you, and that's totally okay. So back to that double leg hip hinge that we did in the last video. Now we're gonna work on a single leg version. So you are ideally going to keep your hips square to the ground, keep shoulders stacked over hips, rib cage is tucked down and in, feel those lower abdominals engaged to keep alignment here. As my chest comes down, my bottom goes back a little bit, and then I press back up. Again, this is going to add a significant balance component. You can always grab a wall for some stability. You can always do a little bit of a kickstand with your back leg to help if balance is seeming a little bit challenging. Then adding a weight can be a great progression to this. So adding a kettlebell or any other weight in the opposite hand loads the hip in one direction. You're having to control the weight wanting to pull you into internal rotation. You're having to kind of fight that. And then holding the weight in the same hand adds a little bit of a challenge. It wants to pull your hip into external rotation, so you're having to control in a little bit of a different way. Again, use that kickstand or a wall if you need support. Working on single leg loading for squatting, you're going to want to grab a chair or a bench. You're going to start by sitting in the chair. You're going to stick your leg out, stand up, and that is where the front leg is going to be, back leg coming onto the chair or the bench, okay? Again, keeping core system nice and stacked, avoiding that rib flare and arch of that low back. You are going to lower yourself down, push through the middle of that foot to come back up. Work to keep your heel down and your big toe down at the same time. Again, use a wall for some balance. If needed, you can also add weight at the chest or in the opposite-sided hand. Now working on a little bit of a plank progression. We're gonna go back into that full plank position. So again, as a reminder, start in hands and knees, get those shoulders over your hands, step yourself back into that full plank position. As you hold good neutral position of your spine, being able to tap your shoulders. You can also add in a little bit of a leg lift. Again, having good alignment of that rib cage and pelvis, working on movements just from the shoulders or just from the hips, doing that extension. We're gonna work on a little bit of a side plank with some progressions. So you're gonna lay in a similar position like doing that clamshell, however you're gonna be up on your elbow. You're gonna line your elbow up with the front of your knees, actually. Your hand is gonna be palm down, shoulder directly over your elbow, okay? The first thing that you're gonna do is you're gonna press yourself away from the floor, engaging that shoulder blade. Hand on your pelvis here. You're gonna press your hips up and forward, okay? You're gonna feel a load of maybe a little bit of your core here, load of kind of your side butt on that bottom side. You can add in some clamshell motions. You can add in some side leg lifts, or you can just do a little bit of a plank hold, going along with some of those guidelines that we set in that previous video, going anywhere from a 10-second hold to a 30-second hold, increasing by about 5 seconds, going anywhere from 3 to 5 sets of each. Make sure that you perform on both sides, and it might feel different on either side. If it feels significantly weaker or more difficult, feel free to do a little bit more repetitions on that side to kind of even things out. Next thing that we're going to do is we are going to progress the heel raises that we did in the previous video to a single leg version. Again, you can hold on to a wall. Gonna go into a single leg, keep that leg straight, going straight up, keeping even weight underneath my big toe and my pinky toe, doing 10 to 15 with a straight knee, bend that knee, doing 10 to 15 with a bent knee, making sure that I change. Again, a progression would be able to do it without holding on to a wall. Super important if getting back into running is something that's in your postpartum goals. A progression of the row, we're going to be in a little bit of a lunge position. I have the resistance band a little bit higher up in my door hinge. And what I'm gonna do is pull across my body in a chop position. Again, switching, outside leg is forward, engaging my core, pulling those hands down and across. So I'm working external obliques on one side, internal obliques on the other side, creating a little bit of symmetry in that core. Again, if it feels more difficult one way versus the other, feel free to increase the amount of sets and reps that you do on that more challenging side to kind of even some things out. The last progression I'm going to give you, reviewing our carry, where we were just carrying on one side, keeping that shoulder nice and engaged, keeping rib cage stacked on top of pelvis. Now what we're going to do is we're going to add a march, okay? So the inside leg is going to march up, step forward, march up, step forward. The weight is pulling us here. We have to use this glute and our core to keep ourselves straight up, okay? Keeping a little bit of good balance here. Keeping that core engaged. Make sure that you're switching sides, remembering inside leg is the one that is lifting. And again, making sure that that pelvis is staying underneath you and not arching forward as you're lifting up. That will contribute to a little bit of pinching in the front of that hip. So if you feel a pinch, just make sure that that pelvis is really getting underneath you and you're not arching forward for stability. You're getting some support from those lower abdominals. So give some of those progressions a try. And again, reach out if you have any questions.